There have been many different voices calling for the defunding of police right across the continent. But what does defunding the police mean, and what would it look like in Saskatchewan? Judy White is a professor emerita in the Faculty of Social Work at the University of Regina. She's also the former dean of the faculty and a former social worker. She joins me now from Saskatoon. Thanks so much for your time.
Well, thanks for the invitation.
Judy, what does defunding the police mean, and can you give us some examples of maybe other countries that have done it?
I think it means different things for different people. So we know that in the US in particular, that there have been different approaches to policing. But I can think about places, for instance, like New Zealand in particular, where there's been a different approach to policing. So what I would say basically is that different people have different definitions of policing. Some folks are thinking that it's going to mean the complete disappearance of all funding towards the police, the complete sort of, disbanding, but removal of all funding. And I think for most of us who are involved in community work, we recognize that what it actually means or could mean is redirecting funds so that the police itself will look different from the way it currently looks. So, really, when we're talking about defunding, it's about rethinking how we fund police and thinking about redistribution so that we might be doing things like placing more money into social services, into health, etc. So in lots of ways, it's about redistribution, recognizing that if we have limited part of money, that we have to make sure we take care of everyone, and we think about equity as well.
As a former social worker, you've worked closely with police officers over the years. Tell me about that.
Well, I worked primarily in rural social work, and one of the things I will say is at the time that I worked, my approach was to work in partnership with the police. What I think was different for me is that we didn't automatically think about the police when there was an issue. Um, so, and I think a lot of the folks in community, for instance, if there was something around mental health, somebody called us, we would recommend that they called mobile crisis unit. So there was a recognition that there were professionals out there who were able to deal with child welfare or mental health issues, etc. Where the partnership or the work with the police took place was if I anticipated that there might be something around violence or I was not feeling safe, I would get in touch with them and let them know that I was going out. I'd had this particular call and that I was, this is where I was heading out on my trip. Sometimes that's all I needed to do is to alert them to that. And other times, depending on the nature of the call, I would actually go into the police station, we'd sit down and strategize, think about how are we going to deal with this, always recognizing that as the social worker, that I was the one taking the lead and that sometimes I just needed support. I would say that for the most part, I felt very comfortable with the partnership that I had when I worked with the police.
Do you think that there needs to be more training for police for those instances? Like you said, as a social worker, that you would take the lead. And I don't know in all cases if that's necessarily the case anymore, if there is a call to police about, say, a mental health or child protection issue.
Well, I mean, first of all, I mean, I think a lot of us are questioning why the public is so regularly calling the police as the first line. Is it because they there aren't the resources in terms of mental health? Is it because they're feeling there will be a longer wait? what has happened, and I guess that is one of the reasons why we're all talking about defunding right now. Um, I I believe that the police, just like any other discipline, any other profession, we've got diversity. We have, I would say, systemic racism in the province, in the country. There's racism. I think that we all have to learn and understand what racism is, and the police um, is also implicated there in that they also have to be receive the appropriate training, education, professional development. I want to make a point in terms of racism, because I think a lot of the discussion that we've been having really has focused on, you know, the racism, the violence, etc., violent approaches that the police have used. So we do have to talk about what kind of training are they receiving. But I also want to say that in terms of the anti-racism work and training, this is something we have to do right across the board. Even though I say, for instance, that social workers have a role to play, and I felt very comfortable going out, even though I recognize that there are psychologists who are equipped to be the first responders, I also want to point out that in this racist society, that all of the disciplines need the training. So I am not going to say that social workers do not need. I think in the same way that I'm saying that the police need it, I'm also saying that we have racism within the other disciplines. I think that's important to note. This province, this country, there is racism, and we all have to do the training in a very different way. The other thing I want to say is that several years ago, I was a member of the police advisory committee on diversity, and this was at the Saskatchewan Police. And it was a really interesting experience for me, because I think at the time the police was very focused on community policing, but also very focused on working with communities. So we had Indigenous peoples around the table. We had newcomers, people from the newcomer immigrant communities. We had the LGBTQ community represented, and there was diversity, and there was a space for us to talk about what do we want to see in terms of diversity within the force, and about the kind of recruitment strategies, about the kinds of training. Um, I don't know if we have, I don't know, I can't say that I know what is happening now, but I can say that up to 2010, I appreciated working with that committee. I do have to say that what is important as well is diversity within the force, having all the groups represented, because I do know from my work in the community that I systematically hear about the racism, about, even though we're talking about truth and reconciliation, and we're talking about Indigenous ways of doing and working and being, I continue to hear that there is resistance among or within the police. So it is work that we need to do. One of the things that we obviously have to do if we're thinking about policing is looking at the recruitment, who is recruited, how committed are they to the anti-racism strategies that's been developed, and about their commitment to listening to the folks who are on the margins and who have been experiencing violence, racism, etc. The other piece that's important, and I think when I look at the experiences of policing in places like Scotland and in New Zealand, they have taken, Scotland in particular has taken the position of seeing policing and violence in the community, recognizing that they're public health issues. And so they talk about a public health model, and they have actually focused a lot on prevention. And the same thing with New Zealand. New Zealand has focused a lot on prevention. which means they're recognizing a lot of the social issues and inequities that are occurring, which is why we would end up being committed to putting the resources where we need to put them in social services and health, etc. We want to do the prevention rather than a strict, individualized criminal justice system. We want to talk prevention.
Judy, over the years, as we've come to expect more of police, those budgets have grown at the same time that prevention programs have disappeared. What role do preventative programs have in changing systemic racism?
Well, I think one of the pieces for me when I think about what I used to have access to as a social worker in the field, I'll give an example. The Family Support Center, which disappeared several years ago, that was a place where there would be workshops with community partners, with community, a place where women can come and they'd be dropping programs. Women had opportunities to speak about their issues of violence and learn about ways of coping and managing and being safe. You had educational programs, you had just general safe places. I think about the Mother Center in Saskatoon at Station 20 West, where women again were able to come together, meet, talk to one another, provide support to one another in safe places. Community agencies, nonprofit agencies provide spaces for people to learn, to support one another, to build strength. And it again, it's opportunities for us to be proactive and to put some really I think, sort of empowerment opportunities for women. I think about the Global Gathering Place, which is a drop-in center for refugee families. People come there and they learn from one another, they support one another. When you remove those kinds of strategies and approaches, what you do is you leave people hanging. So I can think, for instance, of all the stories of isolation that I hear from folks. I think about parents talking about, having difficulty uh, working with their children, in terms of behavioral problems. I hear, for instance, we need to have more recreational programs. So imagine, one of the examples I often think about is years ago when the Harris government cut funding to community for community resources. One of the things that many of us said was that 5, 10 years, 15 years down the road, we will see the impact. We will see it in terms of youth violence, what's going to be called youth violence and what could be called youth crime. But really, it's about young people not having been given the opportunities to participate, to provide peer support, to be involved in positive activities. I think you can see that in every sector. I can think about Family Service Saskatoon with the kinds of programming that they have had to cut. One of the examples is a youth theatre program that used to be an amazing resource for young people, lots of Indigenous youth who participating in writing the script, in performing. Those programs did not have, weren't sustained because of lack of funding. So that's the kind of stuff I'm talking about. I'm talking about providing adequate support, funding to the agencies so that we work directly with families, provide learning opportunities, recreational, social activities, so that we're really forming a partnership and we're providing opportunities for community to learn from one another, support one another. And you have the social workers, you have psychologists, you have other workers, community workers being there, walking alongside community. When you don't have those things, the risks are high, Yes.
Judy, really quickly before I let you go, I'm just curious, what is something that we need to move the next steps forward?
Well, you know, I've listened, for instance, to people like Charlie Clark, whose work I respect, say, well, we can't lose the funding, there's nothing to cut. And I think we have to have the courage to pull together the different levels of government and talk about um, it's rethinking, restructuring how we provide services to community. Policing will be there, but it should look different from the way it's looking now. And, you know, I will say that in the work that I did in the past, I had the opportunity to work with Clive Wayhill quite a bit, and I appreciated him sitting at our community tables. And if we wanted to develop some new community program, he would say, what do you need? I can put money from my budget into things. That's the kind of partnership we want. So I would say we need to be we need to be brave. We need to recognize it's going to be difficult, but I think it's a long-term plan strategy that should involve all the levels of government and the different community partners coming together to to come up with a new vision of what the community should look like. Um, you know, it's there's work to be done. The initial output, it will require funding, but I think in terms of a long-term plan, I think it'll be worth it.
Judy, thank you so much for your time today.
Thank you.
Judy White is a professor emerita in the Faculty of Social Work at the University of Regina. She joined us from Saskatoon tonight.